Hi, you guys. Welcome back for our daily practice questions. It is day 2 or 3 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. Also, if you are looking to find any of my resources, they're all housed on my website, and my website is linked in the description of this video as well. And if you're looking to join the upcoming 5-week intensive review class runs from August the 11th through September the 12th, and I have 3 spaces remaining. The link to enroll is in the description. All right, y'all, question number 1. A 67-year-old man presents with fever, productive cough, and pleuritic chest pain. His vitals are a temp of 100.9 degrees, respirations are 22, heart rate 96 beats per minute, and O2 sats are 94% on room air. He is alert and oriented, and he has a history of COPD. What is the best initial outpatient treatment? Is it A, azithromycin? Is it B, levofloxacin? Is it C, augmentin? Or is it D, doxycycline? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the best initial outpatient treatment? Again, I always tell y'all if they're looking for a treatment, you need to run it back and see if they have provided you with a diagnosis. Here, they have not, so you got to run it back a step further and look at the assessment findings, right? So we have a 67-year-old man presents with fever, productive cough, pleuritic chest pain. You're thinking pneumonia, right? He does have a history of COPD. So 2 things that really stands out. Has pneumonia, is febrile, is 67 years old, so older than 65, has a respiratory history, a chronic respiratory disease being COPD. So your best answer is going to be B, your levofloxacin. You remember in situations like this, especially elderly comorbidities, you want to go with your big guns, okay? Treat with the big guns. All right, question number 2. A 34-year-old woman presents with a 2-month history of low mood, anhedonia, fatigue, and insomnia. No suicidal ideation. What is the most appropriate initial pharmacologic treatment? Is it A, bupropion? Is it B, sertraline? Is it C, alprazolam? Or is it D, nortriptyline? Take a moment and tell me what you got, y'all. All right, so stem of the question states, what is the most appropriate initial pharmacologic treatment? So again, we're going to look and see if a diagnosis has been provided. It has not. So looking at these assessment findings, we can note that the patient has low mood, anhedonia, fatigue, and insomnia for 2 months, right? No suicidal ideation. So we know this would be a diagnosis of major depressive disorder. It would be mild. It wouldn't be mild. It would be major because it's greater than 2 weeks of history of these symptoms. No suicidal ideation. So remember, first line therapy are SSRIs for major depressive disorder. So your best answer is B, sertraline. All right, and lastly, question number 3. A 22-year-old swimmer complains of left ear pain, fullness, and itching. The external canal is edematous and tender to palpation with some discharge. Tympanic membrane is not visualized. What is the best initial treatment? Is it A, oral amoxicillin? Is it B, warm compress and watchful waiting? Is it C, Cipro and dexamethasone eardrops? Or is it D, hydrogen peroxide ear irrigation? Take a moment and tell me what you got, y'all. All right, and similar question here. What is the best initial treatment? So we don't see a diagnosis, so let's check out the assessment findings. So we have a 22-year-old swimmer. They complain of left ear pain, fullness, itching, and then the external ear canal is edematous and tender to palpation. Y'all, so clearly swimmer's ear, um, aka otitis externa, right? So you would treat first with your Cipro and dexamethasone ear drops, okay? Make sure you're remembering these because what I'm doing now is things that we have covered. I'm randomizing these and kind of rotating them back through as we continue our Pharm series, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio. You can give us a call, shoot a text message to this number, or shoot us an email. And as always, my website is linked in the description of this video, as well as in the bio of this channel, and it houses all of the resources that I offer. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.